good morning, and thank you for joining us today. From the Legislative Building here in Regina, we have Premier Scott Moe and Dr. Saqib Shahab. As well, joining us from the Provincial Emergency Operations Centre is Marlo Pritchard. Both Premier Moe and Dr. Shahab will have opening remarks, followed by time for questions.
Thank you very much. Good morning, everyone, and thank you, Dr. Shahab and Marlo, for joining us here this morning. As you know, the current public health orders that are dealing with indoor masking and proof of vaccination requirements are set to expire at the end of November. And Saskatchewan people, I would say, the vast majority have been following these public health orders, and as a result, they are working. And for that, this government is forever grateful, and we thank each and every person across this province. We now have over 200,000 more COVID vaccines that have been delivered and administered in communities right across the province since the proof of vaccination, proof of negative test policy was announced in the middle of September. 87% of Saskatchewan residents now have age 12 and older now have had their first shot, and 81% would be considered fully vaccinated after 2 doses of the COVID vaccine. Yesterday, we began our vaccination campaign for 5 to 11-year-olds, and there are many that are in the booking queue, and my understanding is in excess of a couple thousand received their vaccine yesterday. All of this is having a very positive impact on our provincial COVID situation. It is reducing the spread of COVID-19. It's reducing ultimately the pressure on our healthcare system. Our new cases and active case numbers are down just over 80% from their peak just a number of weeks ago. They're now at their lowest level that they have been since the middle of August. What we are doing as Saskatchewan people, as individuals, what we are doing is working collectively across this province. But we need to keep doing it a little while longer. COVID cases, as we look across Canada and around the world, parts of Europe as well as in the U.S., COVID cases are continuing to rise. So as we head into our winter months and head into the Christmas season, we need to be vigilant and we need to be careful. And that's why today we are extending the current public health orders around masking and proof of vaccination and proof of negative test for 2 more months until the end of January. So that would be until January the 31st. By then, we'll have a clear picture of what impact, if any, the Christmas season will have potentially on our COVID transmission rates here in the province, and we'll reevaluate where we are and our provincial situation towards the end of January. And at that point, then we would decide whether these measures need to be extended, revised, or ultimately removed at that point. Dr. Shahab and others have expressed concern that we could see case numbers starting to rise again in the province as people get together and start to gather, in particular over the holiday season. However, it should be noted we didn't see any rise in transmission after the Thanksgiving long weekend. In fact, case numbers continued to fall in many cases, and that is due to the measures and Saskatchewan people's adherence to those measures in the province. So I think if everyone continues to be diligent, continues to exercise a degree of caution, and continues to go out and get vaccinated, we should be able to get together safely over the holiday season without increasing the spread of COVID-19. But it does take that extra effort, the effort that we have all been giving for the last number of weeks. So for now, we're going to keep the current measures in place, and the plan is to keep those in place until the end of January. We're going to continue to monitor this situation very closely. And once again, I just say in closing, thank you to all Saskatchewan people for everything you've done and what you continue to do. You are, in doing so, are protecting yourself and protecting those around you. We are in a much better situation this Christmas season than we were last Christmas season. If you look back 1 year ago today, virtually no one in our province was vaccinated. If you look at where we're at today, nearly 900,000 Saskatchewan residents have been vaccinated. So a markedly different situation and a markedly different baseline. There's thousands more that are getting their vaccine shots each and every day. But in saying that, we do need to be cautious, but we can get together. If we do so carefully, we can travel, we can go to Rider games, we can even go to a Rider home playoff game. And these are things, quite frankly, we just simply couldn't do last year. And that is, again, thanks to what Saskatchewan people are doing, following the public health measures, going out and getting vaccinated. So thank you. Thank you. Thank you for all that you've done to each and every person in this province. Dr. Shahab.
Thank you, Premier. So good morning, and I just have a few comments just building upon the Premier's comments. So as the Premier said, since the implementation of these simple measures, over September, October, we have seen a gradual decline in case trends. And we've also seen an increase in vaccination rates. Wearing a mask in public is simple and effective. We have all been doing it diligently for the last few weeks. And especially important in those indoor spaces, even if they're private spaces. If you're getting together with friends and family over the holidays, try to make sure everyone's vaccinated. If someone isn't vaccinated, this is a good time for you to get your 2 doses well before the holidays. And if there's someone at high risk, even in a private indoor space, it's a good idea to put a mask, or someone who is high risk having a mask on as well. I also have been recommending that we should, try to use the best mask we have. We all have our favorites. A 3-layer cloth mask, tightly woven, is perfectly reasonable if it's a good fit. Otherwise, a disposable mask is fine as long as it's a good fit around your face. People at higher risk, immune suppressed, may use a disposable mask with a better fit, especially to protect themselves more, even if they're vaccinated, and even though they've been offered additional doses. We have also seen how, as the Premier said, with proof of vaccination or negative test, we've been able to have throughout, the fall, large gatherings with, not any evidence of significant transmission in those gatherings. So this just shows that just those 2 measures, wearing a mask and having proof of vaccination or negative test, has made a remarkable difference. And we really hope that if we stay the course over December and January with the extension of these measures, we'll have a safe, happy holiday season. We'll enjoy everything we are enjoying right now: concerts, shows, exhibitions, getting together, going to restaurants in a safer manner, and keep our numbers low and allow the health system to further show a complete recovery with further discharges from acute care and ICU. And of course, we are obviously watching other parts of the Northern Hemisphere, both Western Europe and Canada and the US, where there is a resurgence in terms of case numbers. We've all seen the happiness in parents as they've taken the children 5 to 11 to get vaccinated, and obviously that will only add to the protection for families at gatherings and make schools even safer, even though schools have been doing really well. And I'll also encourage everyone to keep watching for announcements of who becomes eligible for booster doses. Right now, 65 and older are eligible for booster doses, 50 and older in the north. This is especially important because while 2 doses protects really well against severe outcomes like hospitalizations, there could be some signs of waning at 6 months, and so getting a booster is really important once you become eligible, especially again as we head off into holiday season when we may be meeting our friends and family after a long time. So, over Christmas, I think it'll be important to keep our gatherings safe, keep them small, consistent with people who are fully vaccinated, and especially because while we have the protection of vaccinations, we also have a more transmissible Delta variant that has created specific challenges, not just for us in Saskatchewan, but other parts of Canada, the US, and Western Europe as well. And I'll finally just close by saying that, it continues to be extremely tragic and heartbreaking for all healthcare providers when they have to look after, in many cases, young, middle-aged adults, some with young children who unfortunately were unvaccinated, got COVID, ended up needing an ICU bed. It is very tragic, and I think there's still a lot of misinformation out there. I think we all need to support our friends and family to really get that first dose, get that second dose, and protect themselves and their loved ones. If 5 to 11-year-olds can do it, so can all of us. And, we have done really well in our vaccine uptake, 87% first dose, 82% second dose, but I think we still have a ways to go, and there are pockets of low vaccination that unfortunately can create clusters. And while they can create pressures on the health system, but it's also a personal tragedy for every family to get seriously ill with what is now a vaccine-preventable disease. Thank you.
Thank you, Premier Moe and Dr. Shahab. We'll now take questions, and we'll start in the room. Mark?
My question would be for the Premier. Why did you choose the end of January as that reassessment date when Dr. Shahab has said masking may be needed until March 2022?
Yeah, and I would say very quickly, it may be on until the end of March 22. We'll reassess as we get into the last few weeks of January. What the end of January does, and we've discussed this, and Dr. Shahab may have a comment, but most certainly, we find our way through not only Christmas, but in this province, the Ukrainian Christmas is also a holiday that many of our residents celebrate, and a holiday where they come together. And so we want to find our way through that holiday season. We understand that through Thanksgiving we didn't see a surge in numbers, so we know that we can do it safely. But with respect to what may happen at the end of January with respect to maybe revising these measures, with respect to continuing these measures, or ultimately reducing these measures, that's a decision that will be made later in January as we get close to that date. But I don't think anyone should be under any illusions that these health measures would not be extended at that point in time. They are proving to be quite effective. We're down 81% on our active cases. They are most certainly working. We're up significantly in our vaccine uptake, and so it'll be revisited towards the end of January. And there's really nothing at this time saying that they wouldn't be extended at that point in time. Dr. Shahab, you have anything to add to that?
Yeah, I think what I'll say is that obviously at a personal level, we've always said, even throughout the summer, early fall, that it is important to consider having a mask available in closed indoor spaces. So right now the order is extended till the end of January, but like the Premier said, we'll have to see. But certainly, at an individual level, having a mask on you to wear when you may be in a closed, congested area is always a good idea. But at a population level, I think, like the Premier said, we'll have to look at case rates, but also vaccination rates. I really hope that our vaccine uptake has stagnated. It went up about 10% overall, went up by about 20% in some of the northern rural under-vaccinated areas, but it has stagnated. The first doses have stagnated. Most of the first doses right now are in children 5 to 11. So I think, if we continue to see a higher uptake in first, second doses over December, January, the better it becomes for preventing any future waves. But, people who are unvaccinated, unfortunately, will continue to remain at risk of COVID. And we've seen a consistent trend, even in middle-aged and people, that up to 5% require hospitalization, up to 1% require ICU care. And out of the total of 100 who get COVID, not necessarily all who go to ICU, 1% do unfortunately pass away. So it's a very tragic outcome, and we should do what we can to keep those numbers as low as possible.
Follow-up, Mark?
Yeah, just another one for the Premier. Like, when we do get to that reassessment point, do you foresee the possibility of dropping the vaccine passport and proof of vaccination for venues right now? Like, is that potentially on the table?
Well, the proof of vaccination, proof of negative test, which is not totally unique to Saskatchewan, but I'd say more broadly implemented in Saskatchewan, where other provinces have done different variations of it, has been effective to this point. And I think Dr. Shahab had just spoken with respect to it has increased our vaccination uptake here in the province by 10%, or even slightly a little bit more than that. I won't preclude what we would consider at that point in time. I would say that both that policy alongside masking have been very effective in increasing our vaccination rate and reducing our numbers. When we get towards the latter half of January and month by month, the tools that we have available are changing as we approach this battle with COVID-19. I made the comment earlier, if you look back to 1 year ago, previous to last year's Christmas, we virtually had no one in the province vaccinated. Today we have over 900,000 people that are fully vaccinated. That's an incredibly effective tool that we have available and out there today, and people have utilized relative to where we were a year ago. We've talked in here about the availability of monoclonals, which are available to Saskatchewan people now, early intervention treatments. There's pills that are being talked about that may be helpful as well, alongside the public health measures that we ultimately have put in place. So I won't preclude what what that conversation will look like in January. We'll look at what the numbers are at that point in time, what, a number of numbers, not just our COVID numbers, but, what our vaccination numbers are, if we think there's still an opportunity for us to push that vaccination rate along. But I would say it's been effective thus far, and that's why it's being extended out until January, because it's been an effective policy to this point. Anything to add to that?
We'll take another question in the room. Adam?
Yeah, for the Premier and Dr. Shahab, just your reaction to the pictures and messages we saw yesterday with children being vaccinated and the number of kids that went out to get their shots. What are your thoughts on that?
Go ahead, Doctor.
Well, I think many parents were anxiously waiting for children 5 to 11 to become eligible, and I think many are relieved that it completes their entire family. Obviously, children under 5 are not yet eligible, but it just adds another layer of protection, both for children who are at less risk but can still really develop serious outcomes, but also for the family members. Children meet their obviously live with their parents, meet grandparents. The holiday season is coming, so this just adds the layer of protection at the family level for schools, for daycares, for family events. So I think it's all good news.
I would just say I understand. I think there's about 16,000 appointments that have been made as of this morning. So in the first really 24 hours, we have likely about 10% or slightly higher of families that have made an appointment for their child 5 to 11 to get vaccinated. I think tomorrow's numbers will show. I think there's a little over 2,000 vaccines that were administered to our youth 5 to 11. So these are very encouraging numbers. And as Dr. Shahab said, and I failed to mention in my last answer, this is yet again another layer of protection that is available to us to really reduce the spread of COVID-19. A vaccinated person is 6 times less likely to get COVID in the first place, let alone 12 or 13 times less likely to end up in hospital, or 28 times less likely to end up in ICU. Those are even lower numbers, obviously, in our youth. But what this really does is will help us reduce the transmission and reduce ultimately the active case count in the province. So we're excited that people are excited to make appointments for their children, and we're making those vaccines available as we possibly can with the resources that we have.
To Dr. Shahab, what's the timeline on booster for younger people? There's some concern out there about wasting vaccine. And does that factor in at all when deciding whether we're going to lower the age? And when can people who are under 65 or under 50 in the north expect to be able to get a third dose?
Yeah. I think we are watching that data very closely. So as you know, we publish our monthly breakthrough rates. So as the Premier said, the risk of hospitalization is extremely low right now for people who are young and immune competent. But we are seeing breakthrough cases, mostly in people 65 and older. So at this point, the booster doses are available for anyone 65 and older who reaches their 6th month after the second dose. So people who got their second dose sometime towards the middle of May, end of May, are now eligible for boosters, and we are seeing a good uptake. Obviously, it's 50 and older for the north, and indigenous populations and healthcare workers who got 2 doses early on already are boosted. So I think it is important that once you're eligible, you get boosted. We've seen great outcomes in long-term care. We were starting to see an increase in outbreaks in long-term care. Everyone in long-term care, or almost everyone, got a booster dose in September, and those case numbers and outbreaks have come down. Will everyone 18 and older need a booster at some point in the new year? I think we're watching closely. At some point, the benefit of a booster is maybe lower for people who are younger and immune competent in terms of severe outcomes. The vaccine may continue to protect for a longer period of time, but some countries like the UK have announced booster for 40 and older. Israel used it for 12 and older because it may further reduce transmission if that was a factor. So obviously, we're watching all these things very closely, and we'll continue to make announcements as we continue to analyze the data.
There's to some degree, and if there's more questions on this, Marlo Pritchard might want to answer as well, but just the simple resources that we have available to deliver vaccines are being utilized. In fact, the resources that we have available to deliver all healthcare services here in the province have really been stretched over the last 20 months, and I think that comes as no surprise to this table with the the efforts that have been made, in particular in the last number of months. But right now we're working to deliver and make available those vaccines not only to our 5 to 11 year olds, so in and around our schools and in those communities, but we saw this week as well. There's still some real micro targeting that's happening with our vaccine delivery effort into areas where we have lower vaccination rates, and I think the inner city was highlighted as one of these areas in the province. Dr. Shahab and Marlo and I talked about this prior to coming out here, but we have some rural and remote communities as well. Some are Indigenous, some are non-Indigenous that have lower vaccination rates, and it's there's a lot more effort in this micro-targeting effort that the Saskatchewan Health Authority and some of our pharmacies are doing in making those vaccines available in these areas where we'd like to see our vaccine rates just a little bit higher. Alongside that, so we have the kids program or the youth program, the micro-targeting program, and then ultimately, from an operations perspective, the incoming booster program as well, which will Dr. Shahab will likely outline in the next number of days or weeks. But there's an operational side, I think, in fairness, that needs to be considered as well.
We'll take our next question on the line, operator.
We have Allison Bamford with CTV.
We'll take.
Can you hear me now?
Oh, there you are, Allison. Go ahead.
Okay, sorry about that. Talking to other medical health professionals, they say we would likely have to enter the winter holidays with new daily cases in the low double digits in order to completely avoid a fifth wave. We're still seeing high double digits when it comes to new daily cases. Dr. Shahab, I'm just wondering, where do you think we need to be when entering Christmas in order to avoid that fifth wave surge?
Thank you for the question. So I did show some modeling data, I think last week, and I will be presenting updated information, epi and modeling, mid-December. But so far, we are tracking in terms of case numbers in a very satisfactory direction. We are going for the green. That's the most favorable trend. And I really hope we can sustain that. And as the Premier said, it is not just public health measures. It is individual actions that all of us have taken. Reducing a number of contacts, wearing a mask consistently, being especially careful around our gatherings in the home. Is there someone who's unvaccinated? Is there someone who's immune suppressed? So I think all those measures over November, December, and all the holidays are going to be critical. Obviously, we want to go as low as possible, but we have to be realistic. We are seeing what's happening in other provinces and other countries, and so we have to keep our numbers as low as possible, and that doesn't just make our holidays safe, but because out of every 100 cases, that leads to around 5 hospitalizations, 1 ICU admission, 1 death. That the lower our case numbers are, the lower the new hospitalizations are, and as long as our new people hospitalizations are much lower than persons being discharged, that obviously allows a resumption of all services and maintenance of all services. So I think all those factors are important, and if you look at our case numbers, our new cases per 100,000 are still around 8 per 100,000. So I've always said less than 5 is better. Our test positivity is around 5.6, so trending in the right direction. But again, we have pockets of high cases, clusters, especially in parts of the province where vaccination rates are low. There seems to be a tight correlation between that, and it's not even in those 13 geographies. It is community by community, and that's why, as the Premier said, those micro strategies of managing clusters and outbreaks that public health always does, but also, working at a community by community level to increase vaccine uptake is going to be critical.
Follow-up, Allison?
Yeah, I'm not sure if maybe Mr. Pritchard could answer this, but I'm wondering if school clinics have received any vaccines yet, or when they can expect to have clinics opening at schools.
Thanks for the question. I will mention that I know the vaccine is rolling out and the logistics of moving the product, but I mean, Dr. Shahab may have the date. I do not have the date, but I do know that the vaccine is in the province and it's being distributed as we speak.
Yeah, I think we can probably bring this information at a technical briefing. I wouldn't have the latest updates on actual clinics. I did know that vaccines were flowing to all parts of the province. And the other thing is that there's many types of places where vaccines are available, both for children 5 to 11, but for families who may still want to get their first or second dose or a booster. But certainly that detail is on the SHA and ministry website by a community, but we can get some further information specifically on that as well.
We'll take our next question in the room. Lisa?
At the beginning of the fourth wave, Mr. Greener and the health minister, you were kind of hesitant about bringing in new measures. You're a bit resistant to it. Now you're praising their efficacy and talking about extending them, or you are extending them. So what kind of lessons have you learned in the fourth wave?
Well, I would say, you know, I've said this before, is we should have moved a little bit quicker with the measures that we brought in particular when you look at, in hindsight, just how effective they ultimately have been. And I think what you're seeing today is an extension of those measures due to the fact that they have been effective.
Follow up, Lisa?
Sorry, so the lesson that you learned is that the measures are effective?
Measures have been, yeah, the measures, I think, you know, the proof of vaccination, proof of negative tests, the masking measure, the recommendations that are in place, they have been effective. Maybe I would add just this with respect to the measure. You know, governments can bring in all the measures they like. It's ultimately the people that educate themselves as to what those measures are and then adjust how they operate in their daily lives and really adhere to those measures that makes the difference. And, you know, I think us as government, I think all of us across this province can just be very appreciative of what Saskatchewan people have achieved over the course of the last now probably about 2 months, you know, understanding what the measures are and then also understanding that they need to adhere to them, and it's working. Our case counts are down just over 80%. Our hospitalizations are starting to drop significantly now, and they need to continue to drop. You know, we're starting to really ramp back up our surgical capacity and all of the other procedures and programs and services that our health authority normally does provide to Saskatchewan people, and that is only due to the adherence of Saskatchewan people with the measures that are there. So, thank you.
We'll take another question in the room. Murray?
I'd just like you to continue with that thought for a moment, if you could, Mr. Premier. You've been under considerable pressure as a government, and your MLAs have been under considerable pressure at times to drop orders, and as you stated, that's your preference. Can you speak to whether that pressure is still as it always was? Is it subsiding a bit on you or your MLA, as per Lisa's question, in terms of whether it's changing, you know, in terms of Saskatchewan's attitude towards that? And to Mark's question, just to answer all at once, is that did that factor into your decision to limit it to or to specifically pick the January 31st date for both the passports and the passport?
Yeah. You know, the January 31st date I would speak to first, you know, as it arrived at, is it just simply makes sense. You know, it's a couple months out. It is after 2 significant holidays, or one very significant holiday, like the largest holiday that we have in the province, of Christmas. But on the backside of Christmas, we also have Ukrainian Christmas, and we have a significant number of people in this province that do celebrate Ukrainian Christmas. And so this finds our way through both of those significant holidays, provides us with some certainty out for a couple of months. And so the January 31st date was arrived at, understanding that it'll still be winter in January 31st, and we'll still be indoors for the most part. And you know, these measures very well could be extended at that point in time, or they could be revised or changed to some degree as well, and we'll assess the situation there. With regards to pressure, there's pressure both ways. You know, there's pressure to implement a number of more significant measures, and there's pressure to remove the measures ultimately that we have. And you know, maybe this would speak a little bit back to Lisa's question as well. And if there's anything that I think all governments, ours included, have learned through the course of the last 20 months is a few things. One, these aren't measures that they're not desirable for governments to be implementing. No government, I believe, enjoys implementing public health measures on the broader population. However, in saying that, they have proven to be very necessary, in particular at certain times. And we feel that the measures that are in place here today have been effective, and they most certainly are necessary as we look out over the course of the next few months, given what some of the modeling says, given what where our numbers are, and they are on a decreasing trajectory, and also given just how effective these measures have been over the course of the last number of weeks. And so that's the pressures that are out there, I don't think influence the decision. However, in saying that, we have MLAs across this province, on both sides of the House, in fairness, that are talking to Saskatchewan people and listening to Saskatchewan people, and that is important. What Saskatchewan people think is important, but we as a government ultimately have to do what is the right thing to ensure that we are providing every opportunity for us to be successful in our battle against COVID-19.
Just to clarify, is that pressure changing? And that's where I'm kind of going with this, whether it's been a little bit easier because there has been successes, particularly of late, both related to people being willing to carry out the mask mandate and the vaccines. It would seem to me that that might suggest that your MLAs and others that were probably getting a lot of heat earlier on aren't getting quite as much of that. I'm just curious about that.
Yeah, well, you call it heat or call it discussions with friends and constituents, and there's various opinions on all things COVID within communities, within families, and those are discussions that our MLAs have been having for some period of time. At the end of the day, we need to learn what has worked in the past, what hasn't worked. We have always said we need to provide every tool that we have available to Saskatchewan people that might have an impact. In particular, yes, on COVID transmissions, but also on ultimately hospitalizations, and that's really what has been our effort since the beginning of this, is to preserve that hospital capacity. But with respect to, and Dr. Shahab, you might actually have a couple of comments on some of the misinformation that's being made available out there, and people will read this information, and that's to not in any way their fault that this is being provided to them, but it does make it challenging. It does make it challenging in an environment like we are operating in today, when there's information that's being provided, it's being presented as factual, and quite frankly, at times it's nothing of the sort. And so those discussions are still happening between MLAs. I know they're happening in our medical community. I would take note that we've seen a number of members in our medical community really step in and answer some of the questions that are out there with respect to the misinformation, and for that I am grateful as well. But Dr. Shahab, we were talking about this earlier as well.
Yeah, thanks. I mean, what I'd just say is that COVID has, like many things, polarized society, not just in Saskatchewan or Canada, but globally. Obviously, the more the proportion of people who get vaccinated, the easier it becomes, but still, that polarization can persist, and a lot of it, like many people who reached out to me about vaccination, that I had said that I was surprised that I used to brag that I didn't know anyone who was unvaccinated, but when the requirement to be vaccinated as a healthcare provider or a public servant became, I was surprised to hear from a few people who reached out to me, and they were well-educated people otherwise, but they had just gotten pulled into something on social media which sounded very credible, but it was totally based on false information. And that is a challenge. Like, this is the first pandemic, I think, that we've had in the age of social media, and I think it's heartbreaking to see, in many cases, young parents admit that they had, been pulled into this, decided not to get vaccinated, have been in ICU, or have lost a family member. And I think this needs to be and this is an ongoing challenge. I think credible information is critical, and that's where, again, social media and the internet has played a great role, that we have good research that comes out at lightning speed, and that's available. We have, as the Premier said, therapeutics coming on the horizon, oral therapeutics that will be an added tool that can be used maybe in the early part of the new year. But at the same time, I think it's remarkable how so many people still question the safety and effectiveness of vaccines. And I think we all need to do our part, to talk to our friends and family members. And we need to be empathetic. I think there's been a lot of finger pointing, and I certainly feel that we need to empathize with people who are not being vaccinated. I think there should be no stigma, because we've also seen that people have delayed seeking care because they may be denying that they have COVID, or maybe embarrassed to end up in hospital because they're not vaccinated, whatever the reason. So I think we need to be empathetic to anyone who is unvaccinated, has questions, and just support everyone to get their first, second dose and get their booster dose. And we have to come together. And I feel certainly, further to your question, that I think there has been more coming together of people and communities during the fourth wave, because it's been so distressing. At a time when we had 70+ vaccination rates, having a fourth wave that saw, in many cases, young middle-aged people ending up in hospital and dying was so distressing. And I think, unfortunately, it took this tragedy for people to really start coming together more than being polarized.
We'll take our next question on the line. Operator?
We have Zach Becerra with the Star Phoenix.
Hello, thanks for taking my question. Dr. Shahab, you said earlier that our vaccination campaign has stagnated to some degree and that most first shots are going to people in the 5 to 11 category. Premier, you mentioned that we're looking at, I think you called it micro-targeting of these under-vaccinated pockets that we see in certain communities across the province. I'm wondering if you can both provide some more detail about that. How is this micro-targeting working, and how are we ultimately going to restart our vaccination machine, seeing as it's stalled?
So, several times a week, I talk with my medical health officer colleagues in both Indigenous Services, Northern Intertribal Health Authority, Northern Saskatchewan, rural Saskatchewan, and urban areas. And right from the beginning, a strategy that is equitable has been a focus, that, outreach clinics in core neighborhoods, buses, clinics that run at different times, outreach to shelters. And I have said in the past that, there really should be no reason for complacency or access, because vaccine was widely available. But, many municipal leaders have spoken recently that, access still may be an issue. It may be an issue for busy parents who can't take time off. It may be an issue for remote, rural folks who may be shut-ins. So, all those 5 principles, complacency, access, convenience, have to be addressed, confidence, the calculations people make about should I get vaccinated or not. They all need to be addressed, and they continue to be. I think vaccination teams have gone door to door, sometimes with less success, but sometimes with more education before a clinic comes, with greater success. Some vaccine clinics going to small community have been oversubscribed, and that's been great. Sometimes clinics have gone without maybe some prep work, and hasn't been a large turnout. So I think the strategies vary by community, but they need to continue into December and January. And now, of course, those clinics can provide vaccines to everyone. Pediatric doses are different. It's a different smaller dose vaccine, but at the same time, many clinics have adult COVID vaccines at the same time, and they have the flu vaccine, so families can go and get all 3 vaccines together.
I'd ask Marlo maybe for a comment on this, as well as the Public Safety Agency has been quite involved in some of the rural and remote efforts that we have made. I think back to the earlier days of our vaccination campaign, where we actually were going door to door. I believe it was in the community of Laloche and maybe even a few others. Those are the efforts that are being made and have to be made in the days ahead, in order for us to really target those communities that might have a little bit lower vaccination rate, to not only make those vaccines available, but to bring them right to your doorstep in some cases.
Thank you, Premier. I can confirm that earlier in this year in the vaccine rollout, SPSA, SHA, NITHA, ISC, a number of partners worked with targeting communities, mostly in the north, door to door. We continue to work, and SHA continues to work with the Ministry of Health, developing ongoing strategies to look at those communities that at this point in time have a lower vaccine rate. So again, collectively, we're going to try to target those and develop a strategy where we increase those vaccine rates. So, and we continue to work on that on a daily, weekly basis.
A couple of things I'll just add maybe is that, for example, we were one of the few provinces that got Johnson & Johnson. So a few hundred people, took that opportunity because that's what they were waiting for. And there may be further opportunities for new vaccines as they become available. But I think, we shouldn't wait for that. We should get the vaccines that are available. I've heard a lot of praise for clinics where there were therapy dogs available. A lot of parents with young children called me out and said that, they have children who are always nervous about needles, but the professionalism of staff when to get vaccinated, that in some clinics had special areas, quiet areas for children who may be fussy. I think all that adds up and results in a higher vaccine uptake. And certainly people who are nervous or who have questions, I think you should mention that when you go to get your vaccine, and the staff will then go out of your way to make you feel comfortable.
Follow up, Zach?
Yeah, in regards to the micro-targeting aspect of this, Marlo, you mentioned a strategy is being developed. Can you tell me what that looks like from an actual clinical standpoint? Are we talking about just more clinics and greater frequency? Are we talking about going door to door in more communities? What are some things that we're going to be trying now that we haven't maybe done previously or haven't done as much as we're doing now?
Thanks, Zach. I am going to turn that over to Dr. Shahab. He's been involved in those conversations, but I can tell you that we will bring further information on technical briefings as the strategy continues to develop into different communities. But as I indicated, this conversation between Ministry of Health, SHA, public health officers is an ongoing and will continue to go in all fairness in the near future. Again, trying to increase those vaccine rates. So the strategy is developing ongoing. So go ahead, Dr. Shah.
Yeah, and I just want to add that, and certainly we can bring it in a better narrative, some of the success stories, but and there's been many success stories, but these kind of micro strategies can't be centrally run. They have to be locally devised. The community has to give solutions. They have to talk to local leaders and staff about what they would like to see. And that's what's worked. So in some cases, pop-up clinics have happened, especially after an outbreak. After an outbreak where there's been unfortunately many cases or hospitalization and deaths, immediately there's a pop-up clinic and hundreds of people have shown up. In some cases, there's been outreach clinics in parts of the town where where it would have been harder for residents from there to take a bus to another part of town where the main clinic was. In some cases, it's been clinics in shelters or outreach to specific groups. Some of the centers that welcome new Canadians have done vaccine clinics. So I think it is very much local context that's important, and I think that is what will need to continue. Working with local community leaders, whether they're municipal, faith-based, other leaders, I think that will be critical as well.
I would just add, Zach, with respect to that, although it's a provincial effort, provincial strategy, and really instigated at the provincial level, it'll look different often in many ways. And Dr. Shahab mentioned the availability of Johnson & Johnson, the pop-up clinics that can arrive here, there. But there's other initiatives that have been looked at. Some of those have been adopted. Some other, we talked with other provinces that have put in place a counseling fee, for example, for clinicians to be able to actually bill a fee for talking to people about receiving their vaccine. And had very low uptake in other areas of the nation. And so I don't believe we actually moved on that here in Saskatchewan, just simply because it wasn't proving to be effective in other jurisdictions. But Dr. Shahab and Marlo both mentioned, I think one thing that is very important when we get into segments of a larger community or a smaller, more rural and remote community is that local leadership is paramount as far as what that strategy looks like in that particular area. In La Loche, it was door to door. I see in communities not too far from where I live, where there's community gatherings where they'll have a pop-up clinic arrive at that community gathering that is having some success. And each person that receives a first dose or a second dose at those clinics is one more than we had ultimately yesterday. And then there's also then the operational resource side on some of these initiatives, and so this is why it'll be a little different depending on where we are and what we're trying to the population we're trying to address. But I spoke earlier about the operational resources that we have available as our many of our healthcare workers, rightfully so, go back to offering the programs and services across the health sector. And as we continue to increase our surgical capacity here in the province, we have, as I said, our 5 to 11-year-old vaccination program is underway, and there's a number of resources that are allocated to that. And we very quickly, as we spoke about in an earlier question, I would like to move forward with some degree of expansion to the booster dose availability here in the province as well. And so there's some operational constraints, given that we are bringing our healthcare system proper back up to a capacity that the people of the province expect and deserve, and that is occurring as well.
One thing I'll add is that, in addition to what the Premier said, some primary care officers, physician officers have always given flu shot. The bulk of the flu vaccine is given by pharmacies, and then it's heard by public health. But some physicians have always had flu shots. Now they may also now have COVID vaccines available as well for adults. And then especially for the age group who are eligible for a booster dose, 65 and older, you're more likely to visit your physician for a chronic disease, and those would be opportunities to get your booster shot as well. So every little bit helps. So there's certainly a further expansion of where COVID vaccines will be available in relation to the flu vaccine. But again, I would say for the bulk of the population, pharmacies, the SHA-run clinics have been where most people are and should be getting the vaccine.
We'll take our next question in the room. Moises?
What did you learn from last year's rise in cases around this time and following the holiday season that you'll be taking into consideration when you're monitoring the COVID situation this holiday season?
And as the Premier said, we are in a very different place right now. Like virtually everything is open, and not only open, there's big concerts happening, there's exhibitions happening, there's sports events happening, and they're happening very safely through a vaccine uptake that can go higher, but still is pretty good. Through in many venues the need to have proof of vaccination or negative test. Many of the areas where we would see transmission, we are not seeing transmission. And in fact, last year, many of these venues couldn't hold large events. Now they're holding them, and they continued throughout the fourth wave. They did not, they were not stopped, and we didn't see transmission events in those venues throughout the fourth wave. Transmission still is mostly within households. It's within small, groups of friends or family, especially in, indoor locations with poor ventilation. It could be your basement or everyone crowded into a room. That's where we have to be careful that if we are having a family gathering in the home, try to make sure everyone's fully vaccinated, especially if someone is at high risk, may wear a mask in deference to a person who may be older, immune suppressed. Ventilation is really important. Many of our schools and office buildings have great ventilation, but in the home, even opening your window for a few seconds, 3 or 4 times while guests are there makes a big difference. And so, all those things are going to be important.
Follow-up?
So yesterday at the clinics, I spoke to a couple people, and they were telling us how they had difficulties trying to get time off away from work to take their children to their appointments. Now, these could be rare instances, but maybe there's just employers or employees that don't understand the rules around getting time off from work to get your COVID vaccine. What can you say about that?
Actually, you know what? We might have to follow up with that. If that is available, the 3 hours that we had provided for folks to go out and get their, this is a good question, and one I haven't been asked. But we had initially put in place a 3-hour ability to leave work for 3 hours to go out and get your vaccine. And I'll be honest, I'm just not sure if that accounts for you to take your child for the vaccine. I'd have to follow up with an answer to that. Yeah. Good question.
I think what I would just like to say is that I think really employers should support parents getting their children vaccinated. And even for sick time, if someone is sick with COVID or is isolating, in many cases employers have worked. It's been tough for businesses to have someone who is sick and or someone has to isolate. And even there, we now know that if you are a close contact and are fully vaccinated, you don't have to isolate. You can still go to work and just monitor yourself. So that pressure to isolate as a close contact has come down. But still, if someone gets COVID, they have to isolate for 10 days. And, any sports that an employer or friends and family can give continues to be important in those situations.
I would just add to that now, and that's a great question. We'll get back to you with an answer to what I indicated. But employers that, and I know many, if not all, employers have been encouraging their employees to utilize the 3 hours that they had to go get vaccinated, as it creates a safer workplace. You're 6 times less likely to get COVID and much more less likely to end up in a hospital and miss work or spread COVID to your colleagues. And what Dr. Shahab had just said with respect to the majority of spread in small family, household friend settings, it would only, I think, speak to those same employers supporting those families that are making the choice to go get their children vaccinated. So, notwithstanding, challenges around folks' work schedule, that's what we are attempting to do with making these vaccines available in as many communities and as many options in and around the schools as possible. As we said, we've asked the parents to be available and present when the 5 to 11-year-olds are vaccinated, as they need to provide parental consent. Notwithstanding that, very real challenges that I'm sure are there with many families.
We'll take another question in the room. Mickey?
So we've heard that cases could rise over the holidays and transmission is happening in homes. Our healthcare system is overburdened. It's not going to reach sustainable levels until January. So why are we not including more measures to prevent spread, especially since circumstances are changing? I understand that these measures are effective, but they've been effective in, September, the fall, and now we're headed into colder weather, and when there's, people are going to congregate more inside, especially in places of worship.
Well, I think these measures are, just in a way, the answer is in the later part of your question. These measures are proving to be effective, and that's why they're being extended. We came through Thanksgiving without a rise in cases. We've shown that in this province, if we pay attention and are very diligent, that Saskatchewan people can have come together in a gathering and do so in a safe way. The healthcare system, our hospitalizations are dropping, and they continue to drop, and that is a good thing. That is allowing us to redeploy people back to the services, programs, and surgeries ultimately that they offered pre the 4th wave, and that also is a very positive piece and speaks to the strength and capacity of our health care system being returned. So the measures that are in place are working. The measures that are in place are pushing our numbers down over 80%. Our active cases are down since the increase. The measures that are in place are pushing our hospitalizations down, and I think this is why we want to have another look at them in mid-January, is understanding that we are going inside, understanding that there is 2 significant holidays, Christmas and ultimately Ukrainian Christmas, that we want to have a look at these measures closer to the end of January as to whether we extend them as they are, whether we revise them to some degree, or ultimately, I suppose, removing them is also on the would be part of that consideration. But right now, we're comfortable with the trajectory, understanding the the concerns that have been raised by Dr. Shahab and others as we get into Christmas, and we're going to manage our way through those concerns in the latter half of January when these restrictions will be revisited. Anything to add to that? I'm sure you do.
I just say that while, as the Premier said, there's no measure that comes off the table. They all remain there to be considered. But we've seen so many examples of people being very proactive. So, for example, even though places of worship are now, have no capacity limits, we haven't really seen a lot of outbreaks. And just recently, there was a cluster in a place of worship, and it is mostly in unvaccinated people in the congregation. But working with public health, the place of worship proactively went online for 2 weeks for services, while everyone kind of waits out to see if they develop COVID. Obviously, if you're unvaccinated, you need to isolate. If you're fully vaccinated, you can go back to work. But the place of worship itself just went online for 2 weeks. Many sports teams themselves are proactively. They require all, the Saskatchewan Junior Hockey League, they require all athletes and coaches to be vaccinated. So I think all those proactive measures that we, businesses, place of worship, sports teams, athletic teams have taken, all of that is making a difference. And I think the more we continue to do that, the safer things become without the need for additional public health measures.
Follow up, Mickey?
Yeah, oftentimes in this province, including now, we have politicians not taking advice of doctors. Do you think the government plays a role in the public's mistrust around COVID-19 measures and the polarization that exists?
Well, I actually disagree with the question. We've been out numerous times over the course of the last 20 months. Myself and Dr. Shahab, Marlo, others within the health field that have been out and not only speaking to the conversations that we've had around the public health measures that are in place, but also speaking as to all of the other tools that are available, and those tools are increasing on a month-by-month basis. One tool that we have this fall that I failed to mention earlier, and that we didn't have a year ago, is really broad access to testing in communities and self-testing kits in communities right across this province. And I think from an offensive perspective, that is a great tool for people to have. And I've talked to people, in various communities across the province that are utilizing those self-test kits on a fairly regular basis, even though they're vaccinated, but because they are in a business where they're in contact with a number of people. So, the recommendations, the conversations that the government has had with a number of officials, including our chief medical health officer, have always been discussed out at briefings just like this, and they've been acted on. And the question I had answered earlier with respect to the fourth wave, and I've said this a number of times, is we likely should have acted a couple of weeks earlier with respect to the measures that are in place here today. And they are proving to be effective, and in hindsight, that is something that I regret. But most certainly, as we move forward, you're seeing these very effective measures remain in place, and these very effective measures we would expect will prove to be just as effective as we find our way into the holiday season with these public health measures, plus a number of other initiatives that we just simply didn't have in place last year, like 900,000 Saskatchewan people that are fully vaccinated. And so we're aware of the risks that all Canadians face as we go into the winter season with COVID-19 present in our communities, but we're also aware of all of the tools that we have available and continue to make available to Saskatchewan people as well. Anything to add, Doctor?
Yeah, no, I think, our approach to this will have to continue to evolve as we come out of the pandemic. Ultimately, we have to come out. And but again, as the Premier said, testing, point-of-care testing has been a very valuable tool in many parts of the world. And Saskatchewan was the first to deploy point-of-care testing, as Marlo mentioned, in the far northwest. It was the first jurisdiction in Canada to deploy that as a frontline tool. And now with self-testing kits widely available through schools, through chambers of commerce, I think many people use that when they have any concern. And then, of course, if you test positive, you should go for a confirmatory PCR test and self-isolate. So all these things, as they develop and become more easily accessible, are going to play a role in helping us navigate our way, out of this over the next few weeks and months.
We'll take our final question on the line. Operator?
We have Katia Saint-Jean with Radio Canada.
No further questions for the time being. Thank you.
Thank you. Thank you for joining us today. That concludes today's press conference.